And over about the last 3 years, I've really been focusing a lot on working with intimacy and sexual health within the oncology experience, mostly with those who identify as female or have what are traditional female genitalia and organs. However, I am also going to talk about some of the male sexual health stuff as well, in case we have any men or caregivers that are here as for some information. I have been in oncology social work for 10 years and a provider or a practitioner for the last 12. So I am excited to talk to y'all. This is a topic near and dear to my heart. If there's any questions, feel free to put something in the chat or raise your hand, and I'll try to answer questions throughout, or we'll just kind of save them for the end. So I'm going to go ahead and get started here. So the topic, obviously, that we're doing today is about navigating intimacy, and we're focusing on sexual health during and after cancer treatment. So first of all, what is sexual health? Because there's a lot of different definitions of sexual health. And a lot of times when we talk about sexual health, we tend to focus a lot on the physical aspect of sexual health, which of course is important, but it's also a physical, emotional, mental, and social well-being. It's not the absence of any kind of dysfunction, but positive and respectful approaches to sexuality and sexual relationships. And so this is a definition from the World Health Organization, who's kind of like the leaders of sexual health. And it's more than just the physical act of having sex. There is a lot of emotional, mental, and social aspects, and sex is very much often formed in context. When we talk about sexual health, what you're going through, what your relationships look like. So sex is not just a simple thing, as some people may have believed in the past, or as was taught to us in the past. So why is it important to talk about sexual health during a cancer experience? Number one is that it impacts your quality of life. We know that cancer and its treatments can impact quality of life generally, but also sexually and sexual health as well. And so if we talk about these topics, and it can really help give us that sense of normalcy and well-being during a difficult time. It's connected to our emotional well-being, and as each of these headings say, addressing sexual health concerns can help foster emotional well-being and provide us with strategies in coping overall with cancer. Sexual health impacts our relationship dynamics with cancer. So talking about sexual health and having a discreet conversation with in our coupleship can help bring couples together to navigate these changes and challenges, really maybe also strengthen their bond or maintain a supportive partnership. And we know that there's a lot of physical changes that happen with sexual health following a cancer diagnosis. By addressing sexual health concerns, we can offer interventions and therapies to help minimize or manage these physical challenges and improve overall well-being. So this is like slide 1 of 2 of why it's so important to discuss sexual health with yourself, with your healthcare providers, and with your partner. Cancer can impact our self-esteem and body image. When we talk about sexual health, we can really help with maintaining a positive self-image with our body, or learning to accept where our body is here today versus what our body was doing before. And it really helps empower us in that way, as well as it helps support diverse relationships. Every relationship is unique, and addressing sexual health can really help recognize that diversity and provide some tailored resources and support. So in summary, overarching, addressing sexual health during and after cancer treatment is essential for enhancing the overall quality of life, promoting emotional well-being, supporting relationships, and empowering individuals to actively participate in their recovery journey. And it really also contributes to that holistic and patient-centered approach that we love to give patients with their cancer care. So as you said, when we're talking about sexual health, it's not just about the physical, it's about everything else that becomes attached to that. So what are some statistics regarding sexual health? And I hope these aren't too small for you to read, but generally it's estimated that 40 to 100% of cancer survivors, and that's anyone following a cancer diagnosis, experience some degree of sexual dysfunction or changes in their sexual health following their diagnosis. The prevalence of this often varies depending on the type of cancer, the stage of the cancer, and the treatments you received. So if we look specifically amongst certain populations, we know with our breast cancer patients, up to 70% of these cancer survivors express sexual dysfunction. Part of that is related to the hormones, to the body image, those big changes that are happening to our body that can lead to sexual health dysfunction. When we're talking about prostate cancer, the prevalence of erectile dysfunction after prostate cancer can range anywhere from 30 to 70%. Again, that can be related to surgical interventions. It could be related to hormones or to things like fatigue or other treatment-related side effects that prevent healthy sexual health. Our gynecological cancers varies, but it can be very significant because if we think of some of the treatments for our gynecological cancers, that can include internal or pelvic radiation, and that can really cause a lot of physical changes to our vagina and the muscles' strength, and you can sometimes get some scarring down there. Another one that we don't talk as much about is our colorectal cancer, and this again can impact both men and women. Sometimes that could be related to body image. Maybe we have an ostomy, or sometimes that pelvic radiation can impact your erectile function, or we can have tightening of the vaginal muscles. And a special population even within the cancer population are young adults. They have some unique challenges related to sexual health because they have impacts of fertility, body image, and overall well-being that some of these sexual health concerns may hit a little bit differently than it would for people who are older adults. Generally speaking, though, sexual health issues among cancer survivors are often underreported, so there's a great chance that these numbers are still low or not as concentrated as what they could be, because many times patients feel uncomfortable discussing these concerns, and healthcare providers may not routinely address them during the follow-up care. So we've always been, many people have been taught that sex is a closed door topic, or sexual health is, and so it can be very uncomfortable to bring that up to your physician. And so many times, if you're not asking or sharing for things, then the provider's also not asking you questions about it. So it's really trying to, again, part of this is going to be empowering yourself to ask for support with this, because there are ways to navigate and improve sexual health during and after cancer treatment. So what are some misconceptions that people have regarding to sexual health? So one of the misconceptions is that sexual health is solely focused on reproduction. It's not. It can include pleasure, relationships, and again, as I keep hitting back to, the overall quality of life. Sexual health is just about intercourse or about penetrative intercourse. And that's also not the case. It can be a broad range of intimate activities. It can be that emotional connection, communication, and a variety of physical intimacy. Sexual health doesn't necessarily mean sex. Talking about sexual health is inappropriate. It helps us address concerns, seek support, and foster healthy relationships if we can kind of break through that barrier. And the other big misconception is that sexual health issues are a normal part of aging. And although we know that sexual health does change the older that we get, the challenges itself are not inevitable. And so speaking to a medical professional and adapting to changes can actually enhance your sexual health no matter what your age is. So if we're looking more specifically as to what are some of the impacts of cancer and its treatment on our bodies for women, and specifically the impact is we can send you into early menopause if you're already not in menopause, or we can complicate your menopause a little bit. And that includes those mood changes and hot flashes are probably the most reported menopausal side effects that we see. You can also have vaginal dryness, pain with intercourse, a decreased sexual desire or decreased libido, fatigue, or sometimes we can have a more difficult time achieving an orgasm. And so because of the cancer treatments in itself, these are very common physical side effects that we see in the realm of sexual health for our people with who are identified as women or have vaginas. When we're talking about the physical effects on men, we're talking more about erectile dysfunction. Maybe we're struggling now with premature or delayed ejaculation, that the ejaculatory system isn't working the way it was in the past. There could also be pain associated with sex. We get that, again, that low sex drive, because again, we're mixing up with some hormones there, and again, changes in orgasm. So there are, again, for just as many for men as are for women, the physical impacts of cancer treatment on the sexual health organs or the sexual health itself. And I do want to highlight, as I'm sure there's no surprise for many folks, that there's also that emotional impact of cancer and treatments. We see increased anxiety. We see on average 15 to 50% of cancer patients experience clinically significant anxiety at some point in time following their diagnosis, as well as an increase in depression of about 10 to 25% of our patients. And also body image concerns, not having certain anatomy any longer. Maybe we're having tubes or bags in places we didn't before. Maybe we have lost our hair. Things that really have an emotional impact on us as our body not belonging to us anymore. And that can also have a big impact in our sexual health functioning and how we view ourselves as desirable or sexy or as a sexual being, so to speak. And so the impact of cancer can have that big emotional impact on our sexual health functioning as well. Cancer can also impact our relationships, and there can be some really specific communication challenges that might arise in regarding to relationships, cancer, and sexual health. And really it's hard because both individuals need to navigate their own emotional experience of the cancer. That fear of uncertainty. Maybe they have different coping styles. Maybe one is kind of laughing everything off because we have to cope with humor, and the other one is just really struggling to do that. So there can be that discrepancy between how do we cope and handle hard times. We can see a large change in roles and responsibilities. If you were the main breadwinner and now you have to take time off work for treatment, that changes the power structure, the relationship structure in the household. Or vice versa, if you were the primary child caregiver and now you're not able to care for the children the same way, that shifts things in the household. And then trying to balance that emotional support between patient caregiver can be difficult too, right? Trying to emotionally support our loved one going through cancer while they're also trying to emotionally support us too can be a little bit of a delicate dance sometimes. Do I have any questions so far or comments? Okay, perfect. We'll hide that. Okay, so how do we address some of these physical changes? So one thing to do if you're experiencing vaginal dryness is to use a good vaginal moisturizer. And I have some pictures included here, and I could pull up the websites too if you want me to go through them later. But a good over-the-counter prescription vaginal moisturizer helps to relieve the dryness down there. And you want to apply those regularly, a few times a week, if not daily, to maintain vaginal hydration. The Halo Gyne, the Good Clean Love, and this white one here, and then the Bonafide Revere. Those are all wonderful moisturizers. They have little capsules and you insert it with an applicator in the vagina, and then you just kind of let it soak in, I guess is the best way to say. Because a lot of times, because of either the hormonal changes in your body following cancer treatment, or if we've radiated the pelvic area either externally or internally, that can cause a lot of tightness. It can cause a lack of moisture in that area. And so this just kind of helps revitalize that area, lets it kind of get used to being a little bit more moist down there again, and can hopefully help kind of reignite some of that natural lubrication to happen. Now, if we are having sex during this time, penetrative sex, it is okay to do during and after cancer treatment. If you're having sex during cancer treatment, please use a condom. Otherwise, it's usually pretty safe, but you could always talk to your doctor, of course. if we're struggling with vaginal dryness, using a water-based lubricant during sex can be super helpful. There's water-based lubricants and there's silicone-based lubricants. And so what we like about the water-based lubricants for the sexual acts is it very much mimics our natural lubrication in the vagina. And so it's not adding, so it kind of helps provide that instant relief and does not irritate like the pH of the vagina. There are some wonderful silicone lubes out there too. But at least for while we're working on trying to repair or get your work on the vaginal dryness, it's best to use a water-based lubricant. And we want to make sure that we're choosing a water-based lubricant that doesn't have any added fragrance to it. We want it to be fragrance-free. Good Clean Love's Naked personal lubricant is excellent for that. It provides some really great not only lubricant, but it's a very clean product as well. Other treatments of vaginal dryness is hormonal therapy. And I will say this with a caveat. We know hormonal therapy is not going to be an option for everyone, depending on their type of cancer. So if your cancer is a hormonally driven cancer, then they may not recommend this. It really just depends, though. But there are some hormonal creams like estrogen creams. Estrogel, I think, is a big one, where it's a topical estrogen treatment that you would insert in the vagina and would help, again, kind of bring those hormones to that lining of the vagina and kind of help revitalize it and get a little bit more moisture there. Again, that's something that you very much want to talk with your oncologist or your gynecologist if you have a genetic cancer or hormonal driven cancer, like breast or gynecological cancer, because we wouldn't necessarily recommend those. And you have to kind of weigh like the risks and benefits, because sometimes if it's low enough of a estrogen dose, it's okay, but really you need to talk to your doctor before starting any kind of hormonal therapy. Another thing that can help us, and this is not so much for vaginal dryness, but sometimes if our vaginal canal has tightened up a little bit because of the cancer treatments, and usually we're looking at our folks that have whole pelvic radiation, either for gyne or colorectal cancers. Sometimes we need to work on reopening that vaginal canal, and dilators are a great way to do that, or engaging in regular sex, depending on your preference. The dilators can be used to help stretch and expand the vaginal tissues gradually. And so Intimate Rose is the name of a company of where I got my beautiful little picture of all the different sizes of dilators. And I recommend, if you're interested in dilator therapy, to go to like a gynecologist or a sex clinic, like a sexual health clinic, to get fitted for the right size, because not everyone is going to be able to start at the same size. So making sure you're starting at the right size, and then what size you want to build up to depending on your partner or your preference. Now let's talk about libido. So there can be lots of reasons why there's low libido. I think when I'm doing sexual health counseling with a lot of women, they just say, I could take or leave having sex. I'm just so over it. I just don't want to have it anymore. I have no desire. I have no drive. And so again, some things to kind of consider medically for this is some hormonal therapy. And again, talk to your doctor ahead of time. For females, this Bonafide Restella is a supplement. Definitely ask your doctor about that if that's something you want, and that can really increase your sexual desire for women. So it's like an alternative medication. It's not hormonally based. For many men, you hear of medications like Viagra or Cialis. Those will help with erectile dysfunction. It doesn't always help with the underlying condition as to why they have the erectile dysfunction, but it may at least give the ability to have an erection and have satisfactory sex, if that is your goal. If we have other medications that might help with erectile dysfunctions, or like some antidepressants have been shown in studies to help improve erectile dysfunction with consistent use. So that might be a conversation to have with your doctor. Mostly for men who are struggling with erectile dysfunction or issues with their erectile Like if they're having pre-ejaculation or delayed ejaculation, you really want to go see a good urologist for that. When we're talking about low libido, we also have to keep in mind that there's other reasons to have a low libido, not just because of the cancer, though that could be a big piece of it. If we're struggling with things like depression, or if we're having some, we're having like anemia and we're really fatigued, or if there's other underlying things happening, we also want to make sure we're treating those, because if we do, maybe we'll have some more energy or some more desire to do that. And then we also want to look at psychological counseling, and I'll go talk about this a little bit more towards the end, but there are some other exercises that you can engage with counseling to help improve or try to cultivate desire with a partner to see if that improves your guys' relationship or gets you back on track with where you want to go sexually with one another. So menopause. Menopause is probably one of the biggest symptoms or outcomes from cancer treatment that can be a really big struggle for many of our patients. So how do we actually treat menopause? That's a great question. So again, we want to look at hormone replacements. This involves replacing estrogen and replacing the estrogen to alleviate symptoms. But again, really with the caveat that you really need to talk about this with your physician before starting any kind of hormonal treatment. Even if you don't have a hormonal cancer, it's always good to ask before you do. And similarly, like when I was talking about with erectile dysfunction, non-hormonal medications like some of those antidepressants may also help manage some of the menopause symptoms, specifically hot flashes and the mood changes. There's also research to show that some mind-body techniques may help us, although not get rid of the symptoms completely, at least manage them or learn to cope with them a little bit. When we're talking about the, let's see here. So there's deep breathing exercises, which is like breathing in through your nose, holding the belly breath, and then exhaling through your mouth. There's the mindful, that should be meditation, not medication. But meditation can help manage stress and overall mental well-being. Yoga is great because it can enhance your flexibility, reduce muscle tension, promote relaxation. And then if you combine yoga with controlled breathing, it might help be beneficial with managing hot flashes and improving your mood. Progressive muscle relaxation, that involves tensing and relaxing different groups of your muscles to help promote a sense of relaxation and again, reducing that muscle tension. And so that can help when we're feeling more stressed or anxious related to menopause. Acupuncture is amazing. And so some women find relief in menopausal symptoms, including hot flashes and insomnia through acupuncture. And then finally, massage therapy can help alleviate muscle tension, improve circulation, and promote relaxation. And that might help if you're struggling with the muscle aches and joint pains that come with menopause. So there's not going to be a quote unquote cure for menopause, but maybe trying some of the hormone replacement, non-hormonal medication with some of these mind-body techniques may help us kind of feel like we have a better handle on how to manage these menopausal symptoms when they arise. Something else to consider is pelvic floor physical therapy. And you may have heard of pelvic floor physical therapy before, because sometimes after birth is given, after you give birth, and your pelvic floor might be a little bit weaker, and that's might be why we kind of pee a little bit when we laugh or sneeze. That means your pelvic floor is weak and you tighten it up. Alternatively, sometimes for men and women, our pelvic floor can be too tight. And so we need to go to pelvic floor physical therapy to learn to relax those muscles and help strengthen them too at the same time. And so we really enjoy or really encourage the use of pelvic floor physical therapy if you're having painful intercourse or any kind of pelvic pain or even erectile dysfunction. I think the pelvic floor of men is not often discussed as much as it could. And if you really work on kind of strengthening that pelvic floor, you may see an impact in your erectile functionality. Also, when it comes to our ladies, we can really use that pelvic floor therapy to really kind of help if we're having a hard time with our vagina being too narrow, maybe there's some scar tissues, or if we're having a hard time accommodating our partner between using pelvic floor physical therapy and dilators that might be able to help widen our canal so we can more easily accommodate a partner if that is the goal. Now let's address a little bit more some of these emotional changes that happen following cancer treatment and related to sexual health. So how can we kind of improve emotional well-being or overall health? Really is build a support system, and that can be either through the use of number two, support groups, your friends, family, peers, people at work or church, peer support programs that are, widely available for cancer survivors. And also seeking professional counseling. I think the biggest thing is knowing that you're not alone through your journey. Even if the journey has ended for you and we're entering that post-treatment kind of lifestyle, knowing that there's still support and resources for you is key. And that talking to a group or a good friend or a professional counselor can really help you navigate some of the feelings that you may have experienced during your cancer treatment. Something else really to kind of keep in mind is practicing mindful and relaxation techniques, because overall those can help with stress and help your overall emotional well-being. Something that's important to do is also maintain a sense of normalcy regardless of where you're at in your treatment, but incorporating elements of your pre-diagnosis routine into your daily life is good, and that could be hobbies, doing activities, work, whatever it is to kind of help you feel like there's some normalcy in your routine. And it's also really great to also embrace positive distractions. And those are fun things like watching movies, listening to music, or spending time in nature. Those positive things that kind of distract you a little bit for what you have going on. I think sometimes with how we relate this also to sexual health, this just helps us feel more centered and grounded, and more maybe wanting to possibly like engage too. Some coping techniques that I always like to highlight are the 5, 4, 3, 2, 1 grounding exercise. So if we feel like we're getting overwhelmed or maybe we're having some anxiety, whether that be anxiety about intimacy or something completely different, is to focus on 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And really kind of making sure that you're focusing on each of those things specifically and individually. Also a deep breathing exercise, I've included that too. Breathing in for 4, holding for 7, and I think breathing out for 8, and then repeating that 4 times. Some other kind of coping strategies is really challenging irrational thoughts, and that could be negative thoughts, anxious thoughts. And that's when you really have to examine the evidence and challenge these thoughts to help reduce anxiety. Ask yourself, what are you really worried about? How likely is it that your worry will come true? If it does come true, what's the worst that could happen? What's most likely to happen? And what are the chances you'll be okay in 1 week, 1 month, 1 year? And so really the goal of these exercises are to help us stay grounded and focus, try to rein in the irrational mind a little bit. So we're not doing so much catastrophic thinking of the what ifs and focusing more on the present with things. I also really love journaling, whether that be a gratitude journal as to things that you are grateful for. That could be a person, job, or something you did with friends, big or small, or doing a positive journal, which, things that went well for you today, and focusing kind of on those things. So when we combine focusing on our physical aspect of sexual health with our emotional well-being, we're hopefully improving your overall quality of life, because we can't really, we would just focus on one and not the other. It's going to feel like there's something missing, or that we're not addressing you as a whole person. If we're struggling with anxiety and depression, that's going to impact our desire, right? And even if we fix all the mechanical pieces of it, if we're still not feeling that desire, we're still going to have difficulties engaging in intimacy or sex. So kind of tackling it from both a physical and mental perspective is really what's going to give you your best outcome, through utilizing some of these coping strategies with some of the physical interventions to help get your body working in the right direction for you again. As we kind of talked about or brought up briefly, Cancer changes your relationships. It changes your relationship with friends, with families, with yourself, and definitely changes relationships with your partner. So how do we navigate these changes in intimacy, knowing that maybe physically or emotionally, we're not going to be able to do intimacy in the same way that we were before? So when we talk about intimacy, what does that actually mean? Again, I think many times we think intimacy, we think of the physical side of intimacy, we think of sex, but really intimacy comes in different types. It can be emotional, spiritual, intellectual, and experiential. So sometimes it might just be figuring out what intimacy with our partner best fits where you're at in your recovery, in your lifestyle, and where your interests are. Excuse me. I think the biggest thing is to kind of give yourself time. I think a lot of times when we are done with that initial phase of cancer treatment, if that's where you're at, we really feel this like drive or this desire to want things to go back to normal or whatever that may be, right? But we want our body to hurry up and get to where we want it to be. And so I think something you need to do is just really give yourself time to adjust to the physical and emotional changes that cancer causes. You know, if we're having side effects, really just kind of giving yourself time to adjust to that and make accommodations for, right? If it's painful to be in a certain position, then we don't do that position, or maybe we get like a pillow, or we play around with positioning a little bit. You know, if we're having a hard time with fatigue, well, maybe we have to do a little bit more foreplay beforehand so that you can still both get to your goal of an orgasm without wearing yourself out too much with the actual physical act. So it can be really getting creative when it comes to that physical intimacy. And also coming to terms with the changes to your body, we have to really give ourselves time to cope and adjust for that, and kind of do some body image work, or really kind of come to trying to find a way for us to be neutral about where the body is, and that there has to be some acceptance because this is the body we have today and not focus so much on the body we had yesterday. And also understand that these expectations, that setting realistic expectations for yourself will change the further away from active treatment you get, and that sexual health and intimacy may be like a more fluid of an experience for you because your abilities are going to change depending on where you're at in your treatment or in your post-treatment life. I can't speak enough about how important communication is for building intimacy. Sometimes we may see folks that are really anxious about resuming sexual activity, whether it's during or after cancer treatment, fearing that sex will hurt, that you won't be able to perform, or that your partner will no longer find you attractive. Those are very common thoughts that kind of go through our head when we're talking about getting back into a sexual activity. And so when we're anxious or worried about those things, we're trying to engage in sex, what does anxiety do to our body? It tenses us all up. So if we're already struggling with some vaginal pain or pain with penetration, tensing up because of anxiety is not going to help us, our cause. So might be doing some kind of work on relaxation techniques with your partner, or having communication with your partner of how you like to be touched or not touched these days, or how far you're willing to go or not, or able to go right now. And similarly, your partner might be anxious about putting pressure on you to initiate sex, or they could feel guilty because if maybe you tried having sex before and it really hurt you, they might be scared to do it again. So really trying to have that open line of communication where you guys can talk about each other's needs and preferences is really important. And if it feels like that's an uncomfortable conversation for you to have, or you're not sure where you even start with that, that's where talking with like a licensed professional might be really beneficial for you, for your coupleship. And I think we also have to look at redefining what is intimacy and sex, right? Even if you can't have sexual intercourse, you can still maintain intimacy through loving affection, like going for a walk, going swimming, doing activities together. Maybe you can dim the lights and put on some romantic music, really maybe set the scene with some candles, give a partner a massage. Focus more on the sensual and not the sexual. So finding ways that you can still feel that physical and emotional connection with your partner is wonderful. It doesn't have to lead to sex per se, but just kind of creating that sensual environment and focusing and staying within that space is a really great way to kind of cultivate that intimacy. And if that's not something that you feel comfortable with or doesn't make sense in your partnership, you can still do other things together to help you feel connected, like, you know, reading together, going swimming, watching a movie, doing some of those activities. Something that I talked a little bit about too is maybe some places of your body that you don't like to be touched as much as others. And so what you could do together as a couple is do a body mapping and color it according to the areas that you like to be touched. Green means, yes, please touch me here. I love being touched here. Yellow is, it depends. Sometimes I like it, sometimes I not. And then red is a no-go. I don't want you to be touched. You know, and we want to explain, make sure our partners understand what the different colors mean, because it's not always self-evident as to what touch is good or bad unless we have that conversation. Because some areas may be colored red or yellow for many reasons, like due to surgery or treatment side effects, and doing a body map can help, you know, clear up communication with your partner. So what are some additional resources or support? So there are some sexual health clinics, and I did look for ones that were maybe a little bit more local to your area. And by local, I mean Chicago. So the Northwestern Medicine Center for Sexual Medicine and Menopause is a great resource. That's downtown Chicago through Northwestern. And then the U Chicago Medicine Prism Clinic, that's an integrative sexual health clinic. They both provide really great, not only helps with the physical mechanical side of sexual health, like some of the vaginal dryness, if you're having vaginismus or some, you know, itchiness in the vagina, or having any other kind of issues with erectile, not erectiles, because these only deal with ladies, that those are really great resources. There's not a fully dedicated sexual health clinic for men, unfortunately, so your best is still work with like a urologist for that. Also in Wheaton is Dr. Barbara Hanna, and she runs My Menopause RX, and so she also does a lot of work with women who's struggling or having difficulties with menopause life, as well as other types of sexual dysfunction, but she really does help focus on that menopause. So I did want to give her a shout out. I have no affiliations here, just wanting to give you guys some really tangible, good resources to have in case you feel like you need it. So these are all folks that are providers, physician providers that can help with the mechanical piece or the physical aspects of your sexual health. But what about that emotional piece, right? And so that's when you want to look for like a sexual health counselor or a sex therapist. And I know sometimes the word sex therapist can maybe scare people, but really they're just licensed professionals such as myself who really have additional training and expertise in handling and helping with the mental and emotional aspects of self-related issues, okay? And they can work with you individually or in your romantic or sexual partnership. A great way to find them is through the American Association of Sexuality Educators, Counselors, and Therapists. They have a referral directory. You can put what state you're in, and they would pull up all of the licensed registered sex therapists, because each state has different requirements, but these are the ones that have done not only the additional training, but the additional supervision to be like licensed within their state as a sex therapist or counselor. So they're a fabulous resource if you're interested in some more individualized sex therapy care. Or you could search through Psychology Today. You're able to search through your insurance with a special topic of sex therapy and be able to find a potential provider. I will say that many times health insurance does not cover sex therapy, so there might be an out-of-pocket expense with that, but I think it's one of those kind of weighing what do we need the most help with. If we really maybe want to try addressing the anxiety and depression, then you don't necessarily, you know, you could try doing traditional therapy, but if it's really a lot of sex-related anxiety and sexual health concerns, and it's getting a good sex therapist is a wonderful idea. I do also have a few book recommendations. If you're interested in, furthering your own learning, Come As You Are is a wonderful book by Dr. Emily Nagoski. She's a PhD. And so this book really kind of works on the scientific research a little bit about how women's sexuality works, and that it is really about sex and context. So it really takes into mind how stress, mood, trust, and body image are really central to women's sexual health and well-being. And so helping us understand how these factors and how to influence them, that you can create yourself better sex and pleasure. And then the other book I love is by Dr. Lori Brotto called Better Sex Through Mindfulness, How Women Can Cultivate Desire. And so what this does is Dr. Brotto looks at using mindfulness techniques to help with treating sexual difficulties. So this is a very relatable book. She explores the various reasons for sexual problems, such as stress, incessant multitasking that many folks experience. And then she provides like exercises to help increase desire and sexual enjoyment, whether that is because we are having a sexual difficulty or because you just want to give your love life a little boost. Both are great educational manuals. Both are really easy to read, and I highly recommend if you are a woman who is struggling with some sexual difficulties or just wants to understand your own sex better, that these are really great places to start. For our guys out there, we have The New Male Sexuality. This is actually a book from the 90s. I think they've updated it, but it really is almost like the quintessential book about male sexuality from Dr. Zubelgeld. I probably totally butchered this. So he's a psychologist as well, and he really looks at the desire, arousal, and how to kind of keep sex kind of how to help men with sexual health difficulties. Okay. And the final book is just kind of a great read as well. It's Sex Without Stress, A Couple's Guide to Overcoming Disappointment, Avoidance, and Pressure. So it kind of helps for the coupleship to kind of work through some natural questions that arise with struggles with sex. And it kind of gives you some guides to understand the cycle that develops when sex is difficult and how to shift our mindset. So if we are having difficult with sex, then they give ideas on how do we kind of reset ourselves with that.